What is up, my friends? Josh Mason here with a very special video for you. You remember a few weeks ago I posted some videos on cavitations? Well, the results of my cavitations came in, okay? I went to Dr. Stuart Nunnally in Austin, Texas, and he did the surgery, and he cuts open the gum line, he cleans it out with this piezo tool and ozone and a few other things. But he collected the gunk, and in that gunk, which he calls like an oil slick, basically, they collect it, they freeze it, and they send it out to actually, ironically, Dr. Christopher Shade. Man, that dude has his hands in every department of health. So they send out the lab to Dr. Christopher Shade, and we get these results back as far as what were in my gum line, okay, what was in my infected jawbone, okay? So we have entamoeba species, all right? Look at all, okay, so I'm going to go through all of these bacteria and parasites. 9 or greater indicates a serious risk. Greater than 7.5 but less than 9 indicates a moderate risk. Look, I don't know if they only post the things here that are significant, or if they post all of them and I happen to be off the charts on all of them, but almost all of them are greater than 9. And for some weird reason, oh no, that is accurate actually. Okay, sorry, I made a mistake. And this one here is a 7.5. Okay, so let's start reading some of the descriptions here. Tenorella forsythia is an anaerobic gram-negative species of bacteria. Remember, most of these bacteria in the gum line are anaerobic. As Dr. Nunnally was talking about, they actually morph. They can go from aerobic to anaerobic. It would be equivalent to like if me and whoever was watching this, if we were walking on the shoreline and all of a sudden we jumped in the ocean and decided to breathe in the ocean. They're very sneaky. Okay, so we got another one here. Anaerobic non-motile. This is 13.4 on the scale. Remember, above a 9 is a serious risk. Previtola nigricans. Okay, infection sites by binding or attaching to other bacteria. Nothing too interesting here. They're penicillin resistant. All right, that's probably the most interesting thing out of that bacteria. Here's another one. Serratia liquefaciens. It's motile and contained in a flagella, blah, blah, blah. Responsible for about 2% of nosomial infections. I don't know what that is. They can cause urinary tract infections, bloodstream infections, sepsis, pneumonia, meningitis, and other debilitating infections, sometimes even death. The fatality rate is about 75% for this bacteria, and I was harboring it in my gum line. Remember, the immune system can't reach it, right? This isn't a testament to my immune system. The immune system can't reach the gum line when you have your wisdom teeth or any teeth pulled by a conventional crappy Western dentist because they leave the periodontal ligament intact, which prevents the immune system from getting to it. They don't use ozone. They don't clean the area sufficiently. They're injecting you with local anesthetic, which has epinephrine, which constricts the blood vessels, which prevents you from healing properly. So Western medicine too, but Western dentists are doing things ass backwards, and they're creating cesspools for bacteria, viruses, and parasites in your pulled location sites. Fatality rate is 75% from the sepsis cases of liquefaciens. Okay, this is crazy. Okay, it's becoming increasingly resistant to multiple antibiotics. All right, this bacteria, gram-negative bacterium, has been reported to cause rare instances of endocarditis. Okay, which I'm imagining it has something to do with the heart. Infection of the endocardium, which is the inner lining of your heart chambers and heart valves. Okay. So, what else do we got? Anything else interesting here? Okay. How about this one? 15.5. Campylobacter gracilis. Inflammatory, sometimes bloody diarrhea or dysentery syndrome accompanied by cramps, fever, and pain. Okay, also implicated in periodontitis. Quinolone antibiotics such as ciprofloxacin or levofloxacin are no longer as effective due to resistance. All right, this one, a 9.55. This is the one I really wanted to get to. 15.7, Entomoeba species. Single-cell parasite usually transmitted by fecal contamination but can be transmitted by sexual contact. Entomoeba species is typically found in areas of inadequate sanitation and can cause amoebic dysentery. This is crazy, guys. Look at this. Severe ulceration of the gastrointestinal mucosal surfaces occurs in less than 16% of cases. In some cases, the parasite invades the soft tissues, most commonly the liver. Right? So this was in my gum line, in my jawbone. And no, I'm not eating poop, okay? Poop is not part of the Detox Dudes diet. This is what happens when you go to a regular dentist to get your teeth pulled. Okay, I'm not trying to instill fear here. I just want to let you know that at some phase of your journey, you want to get a 3D cone beam scan to get your root canals and your cavitations checked, okay? If you can't afford it now, get healthier, make more money, then do it. But put it on your list, make it happen. Just make more money. Honestly, just make more money. It's that simple. It literally is. When you have a goal in mind and you have your health on the line, you can do anything. You can manifest anything, okay? Read the book, Busting Loose from the Money Game by Robert Scheinfeld. Do some theta wave. Check out the book, The Creation Frequency by my friend Mike Murphy. You record your manifestation behind some theta waves. Manifest more money. Make it happen. Partially from, motivate yourself and get up earlier and do things like that. Yeah, that's great. But the other half of the equation is letting it come to you. It's not all about the, go get it, sleep when you're dead attitude. Why am I talking about money? Because money's the only barrier from getting all of these parameters checked in your health. That's the only barrier. Okay? That's all I got for you. Hope you enjoyed the show. Plenty of amazing videos coming soon. Make sure to like, subscribe, leave me a comment. Let me know what your opinion is on this subject. If you've gotten a cone beam scan, where you've gone. Let's have a list of comments here for all of the best dentists in the country. I know Dr. Jarvis in Marin at Marin Dental Wellness and Dr. Nunnally in Marble Falls, Texas. But what else do we got? All right. And also, leave a comment with some video ideas. I'm creating a list here. Videos to do. Okay? These are all the videos I have to do. And I'm happy for you to watch this. Watch what I'll do. What I'm going to do, how about this, guys? I'm literally going to share this document on my info section. And this is for YouTubers. You're going to comment here. You're going to be able to comment on this video and leave me write an idea down. I'm sure we're going to get some sick, twisted ideas because you guys are, some of you are just messed up and I'll just delete them. But let's do that. Write me a list of some videos that you want me to do. Any one of you. Yes, you. Write me a list. Put something down on my document. You will be able to write on my document telling me what you want me to make a video of. But please put it here, okay? Alrighty, guys. I will share this, and that is all I got for you. Check the info description for that document. Peace.